Today I am going to talk a little bit about prevention in regards to nutrition and ways that you can not only help yourself, but also your loved ones as well. So from many angles, and I know just for myself, I get and hear about so many different research articles and theories about this helps or this doesn't help, and the information that I'm going to be presenting today is based on sound scientific research. You can go onto the internet and find a lot of quackish information, and so do know that everything that I'm presenting on tonight is based on sound science research from universities or hospitals, because it can be you can get a lot of misinformation out there. Do not kid yourself there. So from many angles, we've heard and seen that maybe the only way that we can prevent dementia or Alzheimer's is to really cross your fingers and hope it doesn't help for you, hope it doesn't affect you, or wait for a pharmaceutical intervention of some sort. But the reality is that there are ways that you can prevent dementia, all based on nutrition. And one of them, obviously, eating right, exercising, staying mentally and socially active, and keeping stress in check. Things that you've heard tonight, definitely. And there's going to be things along the way that I talk about that you're going to say, like, oh, she just said that. And it all is going to kind of make sense and interweave together. But by leading a brain-healthy lifestyle, you are able to prevent Alzheimer's symptoms, slow them down, or even reverse the symptoms and process of deterioration. And I'm not quite sure how this mouse works, so I'm just going to do this. So specifically, there's 6 pillars to living a brain-healthy lifestyle. One of them, regular exercise, healthy diet, mental stimulation, quality sleep, stress management, and an active social life. All things that you probably hear about, like, yeah, that's supposed to be healthy for me, or yes, I'm supposed to do that. But these are really going to be the 6 pillars to brain health, and I'm only going to focus on the healthy diet portion from my angle. You've heard about many of the other ones here tonight. So, diving right in, just like the rest of your body, your brain needs a nutritious diet, and really focusing on fresh fruits and vegetables, lean protein, healthy fats, things that you know and hear all the time. But really one of the things that you want to focus on is reducing inflammation. And inflammation is actually a very pivotal player in brain conditions such as Alzheimer's disease, multiple sclerosis, Parkinson's disease, even autism. And so my one thing that I always try to talk to people about in regards to brain health is reducing inflammation. And how can you do that? Healthy fats and limitation of certain carbohydrates. And so we're going to dive into what some healthy fats are. Has anybody ever heard of the Mediterranean diet before? All right, are you familiar, or does anybody follow Mediterranean diet? Mediterranean diet is actually one of the highlights of preventing dementia and Alzheimer's disease, and it's been around for many, many years, but basically the pillars of the Mediterranean diet are as follows. One of them, primarily plant-based, lots of fruits and vegetables, whole grains, beans, nuts. That's going to be the primary source of a Mediterranean diet. Other factors are going to be replacing butter with olive oils or any type of oils, canola oil, that type of thing. Using herbs and spices instead of salt to flavor your foods. Limitation of red meat to no more than a few times a month, and that's really focused on the high-fat red meats. And then fish and poultry at least twice a week. And we'll talk about fish here in a little bit when we're talking about omega-3s. Drinking wine in moderation, and this is optional, so don't feel as though you have to do it to follow the Mediterranean diet. But there are some stipulations, and that's 5 ounces for women. I hear laughter already up here. 5 ounces for women and older men, and 10 ounces a day for the younger male. Those are going to be the limitations of the benefits of wine. Anything more than that per day is actually not beneficial. So 5 ounces for women and older men, up to 10 ounces a day for younger men. And then also the Mediterranean diet does focus on being physically active and enjoying meals with family and friends. And so the Mediterranean diet probably overall is one of, like I mentioned, biggest indicators of helping dementia and Alzheimer's disease. Okay. So, eating a heart-healthy diet, so following a heart-healthy diet is also going to cause brain health as well. And so current research does show that following a brain-healthy diet is also going to be a heart-healthy diet. In terms also going to be a diabetic-friendly diet. This is going to encourage good blood flow to the brain, and it's going to be low in fat and cholesterol. So again, you're going to see some very same factors, I guess, that I'll talk about. Low fat, low cholesterol, and that type of thing. Avoiding trans fat and saturated fat. Trans fat is something probably 5 years ago we had to worry a whole heck of a lot more than what we do now. They've really eliminated a lot of trans fat from many, many food, and really your focus is on saturated fat. And so those saturated fats are going to be anything hard at room temperature, so anything butter or anything like Crisco or any of the fats that are solid or hard at room temperature. Those are going to be the types of fats that you're going to want to avoid. Okay, so this is a really big one, and that's omega-3s, and something that we hear very, very frequently about. I think anytime I mention omega-3s, people shake their head like, yeah, I've heard that, but a lot of times people don't really know exactly what omega-3s do or which portions of the omega-3s are actually beneficial. So evidence does suggest that omega-3 fatty acids can help prevent Alzheimer's disease and dementia. So what are sources of omega-3 fatty acids? The ones that are really going to be beneficial for dementia are going to be your cold water fish, and that's going to be salmon, tuna, trout, mackerel, sardines, that type of thing. You can also supplement with fish oil, and fish oil pills are something that I could talk briefly about here in just a minute. But it's a great supplementation if you don't like fish, and I hear that all the time, like, I hate fish, what can I do to get my omega-3s? And so fish oil is a great substitution. There are actually two types of omega-3 fatty acids, and this is where people don't understand a little bit. So there's long chain and short chain, and I'm going to not try to get as technical and just be very layman's terms. But basically, you may hear some acronyms, and that's EPA and DHA. EPA and DHA are going to be your long chain omega-3 fatty acids, and those are only going to be found in fish and shellfish. So you can't get the EPA and the DHA from plant-based foods. The DHA actually is the long chain fatty acid that has been proven to prevent Alzheimer's and dementia. So really, the fish is super duper important if you are looking for prevention. There is short chain omega-3 fatty acids that is found in plant foods such as flax seeds and chia seeds and that type of thing. They're beneficial, but from a prevention standpoint, they don't prove to be as beneficial as the long chain fatty acids that you may get from the fish. And according to some research that was done at Chicago's Rush Institute for Healthy Aging, eating fish just one time a week can reduce your risk of developing Alzheimer's by 60%. We really do recommend having fish twice a week, but just that once a week is going to reduce it by up to 60%. Okay, another factor that a lot of people don't necessarily understand the relationship is having small, frequent meals. And so instead of having just 3 meals a day, having 4 to 6 small meals throughout the day. And people are like, well, why is that going to be effective in prevention of Alzheimer's disease? And really, it's all about consistent blood sugar levels. You're going to want to try to avoid carbohydrates that are high in sugar or high in white flour, and that's going to rapidly spike your blood glucose level, which is going to cause inflammation. And remember what I just said about inflammation earlier? You're just wanting to prevent inflammation because inflammation of the brain or anything such as that is going to not be so well. A couple other things that I do want to just touch on briefly is eating the rainbow. You hear that all of the time. We should be including all different colors of food on our plate. And this is specifically important for Alzheimer's disease as well, and this is because of the antioxidants and the vitamins that the colorful fruits and vegetables are going to provide. Really, really focusing on those deep, dark colors, the berries, the spinach, the dark greens, the dark oranges and yellows, that type of thing is going to be very important. And back to that inflammation word, inflammation reactions do produce oxidants, and hence you need antioxidants to get rid of the oxidants. So vitamin A, beta-carotene, vitamin C, and E are all going to be those nutrients that have been shown to be low in Alzheimer's patients. Vitamin E is something I'm going to touch on here in just a quick second, but do want to make note of tea. Tea is something that can actually be very beneficial for prevention of dementia and Alzheimer's disease. You hear tea has lots of different benefits all of the time for different diseases, that type of thing. But regular consumption of green tea can actually enhance your memory and mental alertness, slowing your brain aging. And the white and the oolong tea, the teas are specifically healthy for brain health. 2 to 4 cups a day is actually what's recommended. And for you coffee drinkers out there, coffee drinkers can have brain benefits, but not near as good as the tea does. So if you're a coffee drinker like me, I don't care for tea as much. So I can get a little bit of benefit out of that. Supplementation is something that I get asked on very frequently. Is there something I can just take to help me out here? And there's lots of studies out there, some of them favorable, some of them unfavorable, but vitamin E is one of those that continuously has favorable studies that have a protective effect of your brain. A study published by the Journal of the American Medical Association, which is probably one of the highest ranked journals in the country, found that the risk of developing Alzheimer's disease was actually 67% lower if you have a high intake of vitamin E. And you may ask yourself, what are foods that are high in vitamin E? I clearly wrote them at the bottom for you. Any type of soy foods, dark green leafy vegetables, spinach, kale, that type of thing, nuts, seeds, fish, plant oils. And if you think about everything that I just wrote on the bottom there, it all loops back to that Mediterranean diet. Those are foods on the bottom that are very high in, or very much aligned with the Mediterranean diet. A couple other things just to make note of. Giving up smoking and drinking in moderation. These are very, very important. They're two of the most preventable risk factors for Alzheimer's disease. Not only does smoking increase the odds by nearly 79%. Researchers at one of Miami's medical centers warned that a combination of these two behaviors together reduces the age of Alzheimer's onset by 6 to 7 years. And actually, if you stop smoking, the brain benefits, you will gain brain benefits instantly. So the minute you stop smoking, you will instantly get improved circulation in the brain, and it doesn't matter if you've been smoking for 5 years, 10 years, 15 years, you'll instantly start getting those benefits. However, the brain changes from alcohol abuse isn't as successful. So drinking and smoking can definitely help reduce the onset of Alzheimer's and dementia. A couple other things to note is just managing your body weight. Again, a long-term study of 1,500 adults found that those who were obese in their middle ages were twice as likely to develop dementia later on in life. And so being a normal weight can be very beneficial. So again, a heart-healthy diet, exercise, that type of thing. And then this is one that's very interesting, is herbs and spices and how they can help and affect you. Again, herbs and spices was something that I talked about during the Mediterranean diet portion. But cinnamon, sage, turmeric, and cumin are going to be 4 of the spices that have actually really shown to help prevent that brain plaque breakup and reduce inflammation. Cinnamon, sage, and cumin are very popular spices. The turmeric are something that you may not be so familiar with, and so it is the peppery, warm, bitter flavor, and it's actually what gives mustard its yellow color. So that is what iron is. So